I have found in over 2 years of recording people's stories for the Milk Making Minutes, without providing any advice, just listening, that there is uniqueness to every story, even when the story is just sort of normal. It's sort of what we're accustomed to. And one of the things that I find so interesting about so many stories being so normal is that a lot of what happens in modern day childbirthing practices and postpartum advice shouldn't be normal. Doubting ourselves, being worried about low milk supply, babies with painful latches that we can't figure out, topping off with formula immediately. These are things that we might not necessarily have to experience, but because there is so much mishmash between what is actually biologically accurate and what our societal expectations are, our own inner gut gets drowned out by all the noise around us. I am so happy to present to you the personal story of a hero of mine, somebody whose book I read, who really impacted me as a practitioner and as a parent. She'll be coming back next week to talk about airway health and some of the ideas presented in her book. But today, Shireen is here as a mom and a human telling stories of trying to feed her babies. So welcome to the Milk Making Minutes. I'm your host, Lo Nigrosh, an international board certified lactation consultant on a mission to demystify human milk feeding to our human babies. Hi, Shireen. Welcome to the Milk Making Minutes.
Thanks for having me.
Yeah. So you are coming onto the Milk Making Minutes as both a person who has fed little people or a little person from your body and a professional. So I'm so excited to have both of these conversations. Before we get into your personal baby feeding story, go ahead and introduce yourself and your family, however much you would like to.
Yeah, well, I'm a general dentist from Perth in Western Australia. I started becoming interested in airway because of my husband snoring. And at that time, it was driving me pretty crazy. So I decided that I was going to learn more about it so that I could help other spouses in the same situation.
Mm-hmm.
And through that process, I did some postgraduate training and realized that snoring, it's not just a sound, there's a lot of health risk. And as dentists, we're involved in making oral appliances for adults with snoring and obstructive sleep apnea to help improve breathing during sleep. And I started to question, how come we're doing a Band-Aid solution to compensate for poor jaw development? Why don't we help grow children's jaws better in the first place? And so that's what really got me interested in early orthodontic treatment. And even prior to that, form follows function. And how a child's mouth works during sucking, swallowing, and breathing in those early years of life really influences in a big way how the jaws are developing. And so that's how I became interested in breastfeeding advocacy and tongue-tie management and having a look at how we can intervene to influence jaw development from those early years of life. Now, I do have two daughters who are now aged 16 and 13. And they were part of the reason why I became so interested in what can we do in early childhood.
Great. So you have two daughters. I want to take you way back to when you were a young child yourself and ask what your exposure to both breastfeeding and bottle feeding was as a child.
Oh, I had zero exposure to it.
Okay.
And I know personally I wasn't breastfed either. And nowadays, when I meet new mums and I hear that they're already preparing the colostrum even from the birth, I'm really surprised because they're so educated, whereas I went into it not really knowing anything.
And did you participate in imaginative play as a child with dolls or anything?
Yeah, I did have some dolls, but not in a big way, and
Yeah.
not eating at all.
Yeah, I find it so interesting when I ask that question and then I follow it up with, did you have bottles that you fed the baby or how did you pretend to feed the baby? Almost everyone says bottles, and children mimic what they see as the norm.
Hmm.
So we're still, even though breastfeeding is increasing, at least the initiation rates are increasing across the world after a huge decline for many decades, we still see our children mimicking bottle feeding over breastfeeding. I rarely talk to anybody of a generation who is feeding kids themselves who ever mimicked breastfeeding, which I just find so fascinating as a topic, that this is one of the ways that we teach children parental tasks, yet hardly anyone mimics breastfeeding.
Yeah, for sure. I actually sort of had flashbacks of having a Cabbage Patch doll and the whole set of accessories that it comes with.
Oh my goodness.
Yeah,
Wow, even the bottle warmer. I haven't heard that one.
yeah.
Okay, and so then once your family began, you're pregnant, what were you thinking about breastfeeding at that time?
Yeah, with my first daughter, when they came along, I thought it was pretty overwhelming in the hospital. You are just new baby for the first time, and people coming in all the time to check out feeding and telling you how to put the baby on and latching, and it just feels very overwhelming at that time.
Mm,
And just being told, okay, your baby needs a little bit more. Why don't you offer formula? Not even recognizing that that is an issue, just going with it. So then they actually offered formula, and then I went out and bought the same bottles that they were giving in the hospital, went and bought the same formula as well, not even recognizing that that's sort of an issue. We should
mm,
be promoting breastfeeding. Yeah,
mm.
so it's quite overwhelming, and we definitely need to promote more education.
And before you had even given birth, did you consider how you were going to feed? Did you try to educate yourself in any way about breastfeeding?
I think I just assumed that I was going to breastfeed without having a lot of knowledge in that area. I think,
Hmm.
we assume that it's going to be quite natural and that's what people do. But yeah, nowadays I see a lot of new mums come in and they're just so much more educated. Mhm.
It's really incredible. And it can be a double edged sword because all of us don't know what we don't know. And
Mhm.
when we are educating ourselves to the best of our ability, but it's still not working out, it can feel really, really frustrating when things don't go the way that we thought. So I see people becoming almost more surprised by their struggles when they're educated because they did all the work. And that's can be heartbreaking for people when they really have put so much effort in. And then also, depending on where you're getting your education from, you can have so much conflicting advice.
I think generally speaking, there's not a lot of education out there on lactation. And a lot of the time, things are dismissed as long as a baby is feeding the right quality. They're putting on weight and there's no pain. A lot of the other problems get overlooked, feeding.
Mm,
But now uh, we really understand that we need the mouth to work well. How the mouth functions during breastfeeding sets up a child for life, and how, in terms of how their mouth is going to work for, solids and chewing, and how their jaws develop and how they're going to breathe and sleep. I think that it's really important to promote more awareness of the mechanics of breastfeeding, and optimal function as well. And then we can guide parents the best, and not overlook some of the other problems that may be occurring.
yeah. Okay. So you mentioned that you were in the hospital, people were coming in and out all the time. Do you remember your very first latch with either of your children?
I think it can all be a blur for
I
sure.
know.
But I didn't really have any expectations. I just
Uh-huh.
went in, I did it. I just kind of listened to people as we
Yeah.
go. What am I supposed to know? And
Right.
I did find that once leaving hospital the first time, I was able to just get comfortable at home and just let it flow more naturally. And so I think that's quite challenging for a lot of people as well to get all that. It's hard, just to have people in your personal space all the time. You just want a little bit of space to work things out. But people would just keep questioning: is she getting enough? Let's top her up. You need to have some rest. Let's give you some rest, and we'll feed the baby for you.
Right. That's interesting. I mean, your youngest is 13, so definitely more common. But we do see that still today at the hospital. There's a huge focus on weight, as you mentioned. And if the weight is good, you're good. And if the weight isn't what providers want it to be, then they're often not looking at other factors to look at a bigger picture.
Mm-hmm.
Why were people telling you that she needed to top off? Were they concerned about weight gain? Were they concerned about her still acting hungry? Do you remember?
I think it was just the unsettled. Has she had enough or not enough?
Yeah.
Yeah, it really is a blur to really look back at it. I really didn't perceive there to be too much problems at the time. Yeah.
And how long was it that you were topping her off?
No, I was really able to reduce that quite early on, within a couple of weeks.
Okay. And do you think you continued for a couple of weeks because that's just what you were used to? Or do you think that that supplementation was really necessary for that amount of time?
No, I think it was just advice. It's just what is taught in hospital. Let's do some pumping. Let's build up your supply. Here are the bottles we use. Here is the formula we use. Let's continue what you've been taught. I know a lot more now, and I would be more persistent with things and give up so easily.
Right.
And also, we have other people like my husband's parents. They enjoy the feeding from the bottle. So it's kind of nice for them to have that opportunity as well. So
it was a part convenience and then part just following the advice that you were given previously.
It's no expectation, just running with the flow and doing whatever people around me expect at that time.
Yeah. Were things pretty much the same when your second child was born?
Yeah, so with my first as well, there's a lot of other things that I didn't really recognize, like the drainage, mastitis, having a little bit of trauma, nipple trauma at some point. And just really when I was feeding her, I would be up for an hour, 30 minutes aside, and thinking that was completely normal. So I didn't, but when I look back in retrospect, these are the issues that we were having. So with my youngest one in hospital, I was able to feel more confident about feeding and was left to my own devices a lot more. And having had a baby that would feed for 60 minutes, she was a very quick feeder. She would be maybe a few minutes and then she'd be off and maybe feeding more regularly. So quite different. She was a bit more of an unsettled baby. I carried her a lot, so I got by pretty easily in life because she was always slung to me. However, she was more difficult for other people to manage. She was always crying for others. And so she was more unsettled. I did offer her some formula in bottles a couple of time points, but she projectile vomited, even taking up the minutest amount on those occasions. So
wow.
She really was exclusively breastfed. And, around the 6-month mark, there were some concerns with her weight gain. So we went down the whole nutrition path and allergies and what should you feed her. But really, in retrospect, I recognized that she didn't really have efficient drainage. There was a tongue tie there, and she probably would have taken in a lot of air. I remember looking back at one of her baby photos and recognizing, wow, her tongue was absolutely covered in milk. And I didn't recognize this as a symptom where she may have had aerophagia, taking in the air. Maybe she was tiring out because her tongue couldn't lift and suction really well. So very different experiences. At the time, not recognizing that I did have feeding issues, just getting on by.
That's really interesting. And it's interesting to hear that even as a dentist, you did not recognize a tethered oral tie in your own child. And I love this because I tell people all the time that tethered oral ties is not standardized training in any profession, at least as it relates to breastfeeding. So unless you're going to somebody who has sought out additional education and training in this topic, IBCLCs included, then you might not necessarily get the help that you're seeking if you do suspect your child has a tethered oral tie. Often I hear so many times people say that lactation consultants, dentists, pediatricians say, oh, it's just a slight tie. Or no, there's no tie because it's located pretty posterior. So it's interesting that that happened even with your own daughter already as a dentist.
Yeah, because they didn't have obvious anterior ties that run all the way to the tip of the tongue.
Mm-hmm.
And so they didn't have any of those classic symptoms where I'm having a lot of pain all the time or poor weight gain expressed very early on. And so it's really recognizing those subtle issues, which is like the frequent short feeds, falling asleep quite often. Even I can't even remember to think whether she had the clicking or the sounds with it, but I suspect I think it's really important for people to recognize we want a really deep latch to have a big mouthful, and that helps to utilize the tongue more. And that's the most efficient way to drain milk. So I do encourage people now, because we don't know what we're looking at as parents, to book in with a lactation consultant that is specially trained in the mechanics of the mouth and can really help identify issues. Because now that I've been doing this for so long, even things like the body restrictions and how tight the body is, I think that is so valuable. A lot of parents are now educated in this. They can go for chiropractic treatment and osteopathic treatment. And even that alone can actually really help a baby's feeding improve so much. And that is not something that I even recognized when my own children were young.
Yeah.
I didn't even know what chiro treatment was, and I had some negative perceptions of it.
Mm-hmm.
But I started to become more involved with it. Maybe around age 7, I think I saw in my oldest daughter, her neck has a slight tilt. And that's not something that I had identified. And then I start to understand, okay, when we have an emergency C-section, for instance, it's quite a traumatic birth for children, and how that can impact their whole head and neck area as well. And so, yeah, there's a lot to learn.
Yes. And we'll get to your book really in the second episode. But one of the things I really took from your book is often we get this feeling of, man, I'm too late. I wish I had recognized these things when my child was an infant. But it's not too late, because we can still, even if that initial development didn't happen, or if tethered oral ties or other oral motor dysfunction wasn't found before, there are still ways to help our kids to have better oral motor and airway health, even if they are beyond the infancy stage. So for me, your book brought hope that, okay, it's not too late, even if I missed it because I didn't know enough with my children.
There is so different things that we need to look out for at various time points to be able to optimize the function. So, yeah, I think overall, I would really love to be able to connect more dots for parents and tell them what I wish that I had known when my own children were younger.
Yes. And you mentioned with your first having mastitis and difficulties with drainage with both. How many times did you deal with mastitis?
Yeah, not enough to really think that it was a big problem. But now I look back and I think, okay, that is a problem. The cracking issue, the nipple creams to make it feel easier. There is some sort of dysfunctional swallowing.
And then you were a working professional. Did you have a private practice when your children were young? Okay. So how much time did you take to recover, get breastfeeding under your belt before you returned back to your private practice?
I took 6 months off work.
And did you have to pump when you went to work?
Yeah, I think I did pump. But, my first one, she didn't feed for much longer than 6 months. So not as big a deal. Whereas with my younger daughter, she was more reliant on it because she didn't take the bottle. So I probably didn't go back to work as quick with her.
Yeah. So she experienced bottle refusal. And did you bring this up with care providers, pediatrician, or anyone else to get their thoughts on it? Or did you just proceed and problem solve the best that you could?
Yeah, I just proceeded because, having the luxury of being able to stay at home, it wasn't a big deal.
Okay. Yeah, because that's another sign of oral motor dysfunction, bottle refusal. But often when parents bring it up, they're just like, well, they must not like the bottle.
Actually, I can't remember. It's more so she could definitely not have formula. That
Oh,
I may have given her some express milk, actually, to be honest.
yeah.
But yeah, definitely. I remember around the 6-month mark, we went overseas. My husband and I, we did a course, and my parents came along with us, and she just didn't feed. She wouldn't drink for the whole day.
Oh my
So
goodness. And then
so
she would make up for it once she was back with you?
yeah,
Yeah.
yeah. She did ultimately breastfeed for longer.
Mm-hmm.
Yeah.
And what was your relationship to the pump? Did you, how did you feel when you had to pump? I hear a wide variety of feelings, but mostly negative when people think.
Yeah, I can really understand. It's very draining for people to have to find time to do this and then to feed babies. And then, quite often people are doing the triple feeding with the formula as well. It's just exhausting.
Yeah. I have had many people tell me they had a time after they were done with the pump where they smashed it because they were so tired of it.
Yeah.
Yeah. Well, as we wrap up your personal stories and then get to spend some time talking about oral motor health, is there anything that you have that we haven't touched upon in regards to your own feeding experiences, or any last thing you want to share about what it was like for you?
I guess the main take-home point for parents is to seek evaluation with someone who is an expert in this area, and particularly someone that has some sort of knowledge of tongue ties and what an optimal latch should look like, rather than just basing their assessment on, is there good weight gain? I think there's so much more that we can do to optimize feeding, and that will really set a child's mouth function up for the rest of their life. So, yeah, really to be more aware rather than myself.
Yeah, well, we all do the best we can in the moment, given the information we have. Great. Well, thank you so much for being willing to share your personal stories. And I can't wait to have you back on in just a couple of days to discuss airway health as it relates to kids mostly, but really it applies to all of us.
No, thanks, Lauren. Yeah. Hopefully there is something out of there. As I said to you, my journey I felt was so ordinary, but hopefully there's something.
Exactly. I think the beauty of hearing stories from all different places, all different perspectives, all different ages of kids is that we get to see patterns and we get to see how various people felt about various situations, because there's such a wide spectrum of what happens. And it's just really nice to hear a variety of experiences.
Thank you.
All right. Thank you. What part of Shireen's story do you most relate to? Is it that idea that you couldn't really truly get settled until you were at home in your own space, able to kind of think through things on your own? Was it the fact that you were given cause to worry unnecessarily about milk supply initially and being asked to top off with formula right away? Whatever it is, there is something in every story that we can relate to, which is why I love getting to listen to and produce these stories and put them out to you. So as I mentioned, Shireen is going to be coming back. She's going to talk about her book, Breathe, Sleep, Thrive, which sounds like it might not be related to breastfeeding, but it really is. So I can't wait for you to hear her guidance to families and her journey towards understanding airway health and its connection to breastfeeding, to our earliest days of feeding. And with that, if you are in your earliest days of feeding and you need support, please go to my website, www.quabbinbirthservices.com, and book a consultation today. You can book automatically online, both virtually and in person, and most of the time, your visits will be covered by insurance. Don't suffer alone. Don't continue to question yourself. I promise, if you reach out, you will feel better afterwards, and you will feel listened to and supported. Talk to you soon.